All right, good morning. Today we're going to be talking about hypothyroidism. And what that means is basically a low functioning thyroid gland, which is right here in the screen. It's a butterfly shaped gland right around your throat area, and it's responsible for synthesizing T3 and T4 hormone, which are involved in your metabolism, heart rate, blood pressure, and other functions of your body. So here's a little loop that I want to show you guys. So your pituitary gland, specifically the anterior pituitary gland, releases TSH, which is thyroid stimulating hormone. So that is what basically stimulates your thyroid gland to produce T3 and T4. So the onset, this usually happens slowly. It takes like months and years to develop. Although it may happen because of a surgery to remove a tumor in that gland. It could be because of radiation, drugs, pituitary gland problems, or it could be an iodine deficiency. So these hormones, T3, T4, the precursor is basically iodine, so you need that in your diet. However, some people may develop this after pregnancy, delivery, or on menopause. So this is more common in women, and it is more common in Caucasians and Asians. The most common type of hypothyroidism is Hashimoto's thyroiditis, which is the autoimmune disease. So what makes it better is your medication, so your T4 replacement like levothyroxine, which you have to take every day. What makes it worse is not taking your medication, eating processed foods, being in cold temperatures, and having low iodine levels. So thankfully, our salt now is iodized, and that saves us a lot of trouble. So the quality of hypothyroidism is there's really no pain, but there is fatigue, lethargy, feeling cold when other people feel warm. You might have constipation, loss of appetite. Patients might say that their skin is itchier than usual, drier. There might be a mild weight gain because your metabolism is impaired. And although not as common, there might be paresthesias. But as a physical therapist, I wanted to include that there because as PTs in the future, we might encounter that. So there isn't any radiating pain like coming from the thyroid gland. However, the diagnosis does affect other areas of the body. So patients might have dry skin, like I said, swelling, slower reflexes, and slower heart rate. This is really just decreased sympathetic nervous system activity. So the severity ranges from subclinical hypothyroidism or mild hypothyroidism, where basically your T4 is fine, it's normal. However, your TSH from the brain is elevated. Um, and that is really one of the telltale signs that you might be getting hypothyroidism in the future. The more advanced hypothyroidism is basically that typical goiter that you see. If you go to Google Images and you look up hypothyroidism, you'll see that. It could lead to myxedema coma, which is basically just all your organs start shutting down, and it's really the most severe form of this. However, if you have a well managed um, diet and you're taking your medications, there's really no reason why it could lead to that. Timing doesn't really apply here, although maybe in the winter time, maybe around the holiday times, if you're eating a lot more foods that you normally don't eat, a lot of sugary processed meals, it may affect your symptoms, as well as because it's winter time and it's cold out, you may feel colder than normally. So patients are really, what they're unable to do is maybe go to work, maybe they're not going to be able to go to the gym, because really they feel tired, they feel lethargic, they just don't have the same amount of energy that everyone else has. So hypothyroidism may also cause a hoarse voice. So if your patient has a job where they have to talk a lot, like an educator, maybe a phone job, real estate agent, it might be affecting their job. And there's also a link between depression and thyroidism, hypothyroidism. So that's definitely something to look into. Here are my references. Everything was brought to you by the American Thyroid Association. If you guys have any questions, please feel free to let me know. Thank you.